because I wanted to kind of focus today on the antepartum, but during class, we'll probably do a little bit more. Okay. So Jennifer, you hang on as long as you want to. Okay. So,
Okay.
like I said, I'm just now working on this. So as you're going into the HESI, set your mind for success. Okay. Don't say to yourself, I'm not going to do good. I'm not going to do good. I didn't do well as I wanted to. I don't feel like I know anything. If you convince yourself of that, then you're not going to do as well as you could. Okay. So if you have your mind set to the point where, you know, I have learned a lot. I know I've learned a lot, and I'm going to prove what I've learned, and be more focused on your success than on your failure. Okay. So most everyone did really well on that second and third exam, and those are very important concepts. So if you're comfortable with those, you should feel pretty confident going into the HESI. Okay. And then your nutrition. Are you eating well? At least balanced. You might not be able to eat regularly, but when you eat, are you eating good food? That really feeds your brain. So make sure you're drinking plenty and eating right. Okay. Don't deprive yourself of sleep before the HESI. Don't cram. It never does any good to cram. Believe it or not, it doesn't do any good. It's better that you get an extra hour or two of sleep than it is to cram, because your brain is alert then and refreshed, and it's going to work better for you. Okay. And then think about the study tools that the instructors have provided for you. And one more tool I'm going to give you today, I'm going to try to get it done before class. I don't know if I'll be able to or not, since it's probably not, is the NCLEX study book, the HESI NCLEX preparation. I'm going to tell you what in there is good to focus on in that book, what you should read, what you should just kind of skim through. Okay. And it's so that you can say, well, I'm going to work on these pages tonight, these pages tomorrow, and then plan out your study. Okay. So let's start with this question. Okay. Prenatal, early pregnancy. You have a client whose prenatal weight was 105. And now she's at 109 at the 12th week visit. What statement by the nurse is most appropriate? Think of yourself as the nurse. You're the nurse, and you're thinking overall about your client always, okay? Don't think of this as a test, if you can. Think of yourself as a nurse. What is a good way to handle the situation?
No, I don't know if it's right. I was thinking like the third one, your weight gain for the first trimester is normal.
Yeah, that's what I was thinking.
Yeah, because the focus here is, what is she eating? Okay. We don't want to get caught up in 2 pounds, 3 pounds. What are you eating? Okay. If she's 10 pounds overweight and she's gaining a lot of weight, you still want to do the same thing. Okay. So tell me what you're eating. You're putting on a little more weight than what you need to be putting on. It's going to make it harder for labor and delivery and harder to lose. Let's talk about what you're eating. Okay, that's good. That's the right answer. That's the right answer. The next question says, you read it.
Number 2. No, she missed a period. Yes. No,
Yeah. I would say repeat repeat the test at home in 1 week, or
or number 4, maybe.
or number 4, yeah, or your period usually. Oh, yeah, because hold on. Hold on.
Well, why isn't the first one right?
Because don't athletes like have more regular cycles because they're I my daughter's an athlete and they said her cycles are more regular. Sorry, I don't know.
Actually, if they're really serious athletics, they might even not have a period.
Oh wow.
Okay. The reason that one's not right is what? Well, it doesn't say anything in the question that the client is even an athlete. Okay. It has nothing to do with her. Okay. It doesn't say that she's an athlete. So that's not going to be the right answer. Okay. There's a better one.
Number 2, would you like me to order serum ACG?
Well, the cue in this question is she missed her period yesterday. Okay. Usually a positive pregnancy test, if she conceived during her last cycle, during her last ovulation, could show up as early as 10 days after. So it could be that it's just a little early and she could wait a week, but as a nurse, you want to know her for sure. Well, let's talk about this. Are your periods usually regular, or are you ever late once in a while? So I think number 4 is probably the better answer. And you did mention it at one time. Okay, so getting more information from your client is always the best thing to do before you make a clinical decision. Because what if her periods are irregular every once in a while? Then having her redo it or having her drawn an HCG is not indicated. Okay, that was a little tougher. Okay. So she has a spouse with a sickle cell trait. And she's concerned about her growth. What do you know about sickle cell? So this is select all that apply. So you really have to understand sickle cell. I need to add this here.
What I know, if like if it's if it's both of them that carry is a carrier, the child will automatically have it, right?
Okay, so it is autosomal recessive. So the first one's correct.
Mhm. Mhm.
Uh-huh. This one's correct. Oops. There we go. Yes, it is autosomal recessive. But that doesn't mean they'll actually get the disease. Okay, if both parents have the gene, then it's distributed in different fashions. Okay, so they both have to have the gene, and 1 out of 4 children will actually have the disease. Okay, and so this is true also. Okay. In the AFP test, we usually test it after 11 weeks, closer to the 13th week. So this one's true. We can't test it too early. It's not accurate. And then since she is 10 weeks, we're not going to draw her blood today. Okay, so that was a little more information than you actually had to know. So if you remember autosomal recessive, both partners have to have the gene for sickle cell or cystic or whatever you're talking about. So if they both have it, neither one have the disease, they just have the gene for sickle cell. Okay. One child out of theirs, if they have 4 children, each child has a 1 in 4 chance to actually have the disease. Okay. There's a 1 in 4 chance that a child will not either carry the gene or have the disease. Okay. And then there is a 50% chance that a child will actually carry the gene. Okay. So you just have to know that autosomal recessive, there's only a 1 in 4 chance that the child will have the disease, because that's what you want to know. Okay. So autosomal recessive, 1 in 4 chance that the fetus will have the disease. So her husband has the trait. He doesn't have the disease. He just has a trait. And she obviously has never been tested. So we need to go ahead and test her. If she doesn't have the trait, if she doesn't carry the gene, then her baby can't have the disease. If she does have the trait, just like her husband, then her child has a 1 in 4 chance of actually having sickle cell disease. That makes sense? It's clear as mud. I learned this stuff by pictures. That's the only way I can learn. Okay. Now you don't have to know about the timing of drawing the test. You just need to know that 1 in 4 chance that the baby, if both partners have the gene, 1 in 4 chance that each baby will have the disease. Okay. We talked, Karen, before you jumped on, we talked about what antepartum fetal surveillance means. Okay. So let's read this one. Let me add some information in here. That might help you. This one might be a little challenge for you too, but you're learning. So at 20 weeks, just because you probably, it's not fair, but every baby gets an anatomical ultrasound. Okay, at 20 weeks, general surveillance. Okay, it's just a gross anatomical ultrasound just to make sure all the parts are there. We also look at more detail, but overall, it's not real specific of an ultrasound. Okay. So when you read a question like this, it says priority. Okay, even though all of it might be good, what is something you really need to make sure your client understands?
Pain management during labor. For the child.
No, that's not the right answer. In case you wondered. She's only 10 weeks. So what's really important for her to know right now?
It's childbirth class. Yeah.
We don't talk too much about in this class
the
about
food. Okay.
Yeah,
the
foods to
food.
avoid in pregnancy.
So, they love to eat like burger and all of that. Junk food.
Well, actually, hamburger is fine. We don't want any raw fish, any raw meat. Everything has to be cooked very well, or she could develop listeria. Okay, so raw foods, raw meats, large fish, a lot of fish. We don't want them eating a lot of fish. And it's not that you have to know that, but when you look at these questions, this tells you foods to avoid. There are foods to avoid during pregnancy. Canned tuna, they need to limit their tuna, okay, because of the mercury. A tuna is a large fish, so that would be a good choice, even though you wouldn't know the foods to avoid. We haven't taught that in this class. I do believe it's in your text, but we haven't really taught that. Okay. Here.
Is it describe to me what you feel?
Yep. Yep.
That is you're assessing her, right? That's his assessment.
Well, we know the first one's not right, because just because she felt something doesn't mean the baby's healthy, right? And we don't want to tell them the last two, they're not good choices. So yeah, asking her, well, tell me what you felt. It's at 10 weeks, it's a little early to feel movement. Okay. All right. So you're measuring the fundal height, you're palpating the fundus, you got your tape measure. And you see the arrow. If you feel the fundus at that area, how far along? What would you say her estimated gestational age is?
You look like somebody ready. Back up. 36 weeks.
Where this blue arrow is? What,
Yeah.
how far along is she there? How many weeks? 12, 20, 28, or 36?
$28 weeks.
No, she's 20.
Okay. Okay. 36 weeks.
36 weeks is up here. 32, 28,
Oh, that-
24, 20 to 22, 16, 12 to 14. That's for my next student group. Okay. There we go. All right.
Oh, okay. 20 weeks.
Yeah, at the umbilicus. All right. What about this one? Making these a little larger. So what do you think? What psychological signs should you expect as a nurse?
Depression.
Is that because the picture looks like someone who's depressed? Is depression common? The only reason I made this question, because your book does talk about this. It talks about the different feelings that the mother and the father go through in the first part of the pregnancy. They talk about acceptance of the pregnancy, ambivalence. So really during that first stage, it's more of ambivalence, not really quite sure, especially if it's not planned, if it's not a planned pregnancy. Well, okay, I'm pregnant. That's not what I planned. So they're not sure, they're kind of ambivalent the way they're feeling. It doesn't last very long, a couple weeks or longer. That's usually the other ones, possibly if there's a history. Okay. But usually they go through an ambivalent period. And once that mother feels that baby move, or they see a picture of the baby, then it's a point where they either reject or they accept the pregnancy. All right. So the next slide is a little more challenging. Okay. So we have 4 clients here. So we're going to look at these clients and associate these different tests on the side. So the first client is 36 years old. She has a family history of diabetes. She is obese herself, and she got pregnant with assistive reproductive therapy. So she had in vitro sterilization or in vitro fertilization. Okay. So she's pregnant. So what do we need to be doing for her? What tests are associated with her situation? When you think about her family history, everything.
Well, first thing, our diet.
Diet is not one thing that's listed over here. You got to pick the circles.
Okay. Okay, obesity, carry screening. And she's obesity. Oh, she's 36 weeks, so she already had an ultrasound, right?
She's 36 years old.
Oh, 36 years old, sorry. Oh, Lord. So
Yeah.
we could do an ultrasound.
Yeah, it would be good to do ultrasounds for her.
Yeah.
Yeah, so we'll put that over here. We definitely want to do frequent ultrasounds because of her age,
And of
her
our history.
obesity, and because of her her in vitro. Okay, what else do we need to do for her?
We could do an early OGTT.
Yes, definitely, because she's obese
Mhm.
and she has a family history of diabetes. We want to make sure we catch any gestational diabetes early. Good, good. Okay. What else do we want to do?
Mm, Also, we could do neocentric test.
Okay. Well, when would we do that?
We could do that when she's
And
more.
why would we do it?
Just to make sure, because we could make our blood work and all of that.
Okay, so if we did the AFP exam and it was abnormal, then we would definitely want to do an ultrasound and then the amniocentesis. Okay?
Yeah.
So we would do that all for her.
Okay.
All right. All right. What about our type 1 diabetic here? I know I need to revise and add stuff to this slide, but what about type 1 diabetic? She's having some vaginal bleeding and her blood glucose, she's having trouble controlling it. What would you want to do for her?
Well, we'd have to make sure we monitor our blood work.
Okay, so yeah, we better do some blood work here.
Mm-hmm.
She's bleeding. She might be having an abortion. Of course, it doesn't tell you how far along she is. And so we want to see where she is. Yeah, an ultrasound. Yes. Okay, good. Okay. And of course, we're going to do carrier screening and all that other stuff. Yeah. All right. So what about our 16-year-old who's homeless?
She's homeless.
She is.
Okay, she's homeless, so she's homeless, so she's going to need a lot of stuff because
Yeah.
because she's homeless. You understand me? Also to find out, where she stay, if it's suitable.
Okay. So she has a BMI of 17, and she has a family history of skeletal muscle atrophy. So it's a genetic condition.
Okay.
So we definitely need to do carrier screening on her, don't we?
Mm-hmm.
And since she's homeless and she's underweight, we definitely want to do an ultrasound. Yeah, yeah, yeah.
Mhm. And also blood work.
And
Because
blood work, yeah.
yeah, because you want to see if, homeless make sure she's not on any drugs or anything too also.
Okay, so a CBC would also tell us whether she's
What
anemic,
is that?
right?
Right, yes.
Yeah, yeah. Okay, good, good. All right. So we'll put that away.
Mhm.
And then our last client is, she has hyperemesis gravidarum. Okay. She's having some pelvic pain and she's got a fever. What do we need to do for her?
Okay, she have a fever, so um what could cause the fever? So
Mhm.
mhm. So definitely the blood work, fever,
Okay, so we need to see if her white blood cells are elevated, right?
right.
And what else
and
could be going on with her? And what else would you ask her?
um well, I could ask her, just down here. When I could ask her a question like, when she start feeling those pain,
Okay, good. So
and
what changes to nausea and vomiting? Okay,
vomiting, yeah.
okay,
Okay, and okay, so she's having vomiting issue. So then maybe ask her, what she eat, when was the last time she eat, when she started having all these symptoms going on.
okay, okay.
And for that, uh, mm, we could also do a early OGT for her. Also,
Well, there's really no indication for that, though.
that, okay. But we
Yeah.
could also do the ultrasound just to see
Yeah, we
what's
definitely
going
need
on
to see
inside,
what's going on
on
with her
inside.
pelvic pain,
Yeah.
her
Mhm.
fever,
Yeah.
and she's pregnant and
And
she's
she's
sick to her
pregnant.
stomach. So we need to
Mhm.
see what's going on. We need to ask her if she's bleeding.
Yeah. Mm-hmm.
Okay. So I'll work on this slide a little bit
Yeah.
and make it, that helps in your thinking.
Yeah.
All right, let's do this one.
A client made the following statement after finding out that her pregnant test is positive. This is not a good time. I am attending Fortis College. There will be children my schedule is week. Oh my God. And that's it's true. I would start crying if it was me. Okay. No, that's not good. I'm so excited for you. No, that's not good. It's not good. It's not like you're feeling a little overwhelmed. That could be one. You will need to inform your right away. You and the baby father will find a way to get through the pregnancy. That's not good. I suggest that you contact your professor to set up an alternate plan for your class. Oh, that could work. Should I have, let me see, I am so excited. No, it, yeah, it could be 3. I would think 3 or 6, because she really feel overwhelmed right now because a lot is going on. She's thinking of if we could do her exam, to further herself and blah blah. And then now the pregnancy comes, so she's a little bit overwhelmed like me. But I'm not pregnant, but overwhelmed.
Yeah, what when you make a comment to her about it sounds like you're feeling a little overwhelmed.
Yeah,
You're acknowledging what she's
it's
feeling and
going
let
right.
her talk about it. Yeah, you
Mhm.
want to do that before, well, go ahead and contact your professor.
Yeah, right.
That's a
Yeah.
little cold. You need to
Oh,
acknowledge
yeah.
what she's feeling.
Oh,
Okay.
yeah. Mhm.
Okay, one more. And this is another challenging one.
Okay.
This is 24.
Doing the first. Goodness. I would say no, 2 MSAFT with ultrasound at 15 weeks. Oh no.
So look at her gravida parity. She's had 4 pregnancies. So she's pregnant now, right? She's had 1 preterm delivery. She's had 2 abortions, and she has no living children. So she's had 3 pregnancies, now her 4th one, 3 pregnancies, and she doesn't have any children. And these were spontaneous abortions. So, and this might be a little heavy. This is probably not a fair question, but she needs to see a genetic counselor. And we definitely need to do carrier screening, and that might be part of the genetic counseling. We could go ahead and see if she's carrying any kind of blood disorder that's not allowing her to carry a pregnancy. We also might do a hormone assessment. This is a little too deep, I can tell you that right now.
Okay.
Okay, don't worry about that. I'll work on that slide set. I am going to go get something to drink. Let's see.
Okay.